the common cold. The common cold is a mild upper respiratory tract infection that's caused by a virus. It's not caused by a bacteria. And the typical symptoms that you'll have are nasal discharge, congestion, malaise, sore throat, fever, headache, typical signs and symptoms that you would expect with the common cold and these kind of upper respiratory tract infections caused by viruses. You know, you want to be able to compare this to bacterial infections or other viral infections. The flu is another viral infection that we approach a little differently, so it is important for you to seek medical care if these symptoms persist in order to make an appropriate diagnosis. You know, is this the common cold? Is this viral illness that's caused by the flu virus? It's different. It's approached differently. You think as well as bacterial infections, such as like a bacterial pharyngitis or a strep throat, acute bronchitis or acute sinusitis. These are bacterial infections and not viral infections, so we approach these differently. The important piece to know about the common cold is that the treatment for this condition is not antibiotics. Antibiotics will not benefit you in any way if you have this type of viral infection. And in fact, by taking antibiotics for this, you're actually exposing yourself to a higher likelihood that you would have side effects from typical antibiotics. So it's not something that we like to treat with antibiotics. The course of therapy is usually about 1 to 1.5 weeks. And it's basically a self-limiting condition where it will your body will eliminate this virus on its own. It will just basically run its course. If the symptoms last longer than 1.5 weeks or 2 weeks and they become more pronounced, they become more severe, you start having headache or increased sinus pressure, you start having increased drainage and changes in the color of your mucus, you start having purulent or yellow or green secretions, then this viral infection has likely now moved into a bacterial infection, and you may benefit from antibiotics at that point. Symptomatic therapy is basically our mainstay of treatment for the common cold, and these include antihistamines, antitussive agents, expectorants, decongestants, acetaminophen for fever. So we use things like Mucinex, dextromethorphan, pseudoephedrine, and I'd like to cover those symptomatic therapies with you, and this will happen in the next few videos.